the orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice.
Welcome back, listeners. My name's Chuck Dowell, filling in for Sam today as the guest host for this episode, Practical Approach to Nutrition and Adolescence. Dr. Hall is a primary care sports medicine specialist at Children's Hospital in Phoenix. I think one of the things that was very enlightening during your talk is protein's all the rage these days. Everybody says protein, protein, protein. You know, that's what you need to get big, to get strong, to be a better athlete. Can you just kind of, again, talk about some general recommendations regarding protein and the importance of that?
Yeah, I think I'd never want to be too kind of sarcastic about protein. It's very important. But I think the thing that I found, and again, like I said, I sit down with athletes and I do deep dives into their nutrition, and I have yet to find someone who is significantly or even low on protein when they're really not even that good at doing their nutrition very well. Most people get enough protein to be a high level athlete based on what they eat every day. So it's not that it's not important, it's that most people get enough from what they're eating already. And to focus on that over other things sometimes doesn't make a lot of sense. So the general recommendation is 1.5 grams of protein per kilogram of body weight for a higher level athlete. Some of the bodybuilders can get up to 2 grams per kilogram, but 1.5, even right, the range of 1 to 1.5 is enough for young athletes. And so what is the point of that protein? That protein is not used to fuel the body in terms of sports participation. It's really used for recovery after a performance, as well as muscle growth, muscle synthesis. And so the problem that I see is that, going back to your original question, is people will have enough protein in their daily diet, but they don't have enough calories in their daily diet. So what happens is they do this intense, 2 hours of basketball practice with a weight training, and they get their protein in, let's say all the way up to 2 grams per kilogram, more than what they need. But since they don't have enough calories, since they're in negative energy balance, all of that protein is being used just to try to get them through their workouts and get them through their day, although it's an inefficient way to do so. And they end up losing weight or not gaining weight, even though they are eating enough protein. And so, yes, protein's very important for recovery. It's very important for protein synthesis in both recovery and gaining muscle. But the key is that they have to have enough calories on board to be able to get the gains that they want to and have the fuel used for sports performance, and then the protein saved for recovery and muscle protein synthesis. And so that's what I really focus on. Is usually people get enough, and you could just do your own one-day food diary. If you look out there and you see, okay, what items have protein, it's pretty easy to get 1.5 grams per kilo of body weight of protein in. That's not a challenge. And so I think that if people will look at their own daily diet, see how much protein they're getting in, they'll kind of realize that maybe, spending a lot of money on these protein supplements is probably not necessary. I think the saying goes from the literature is, if you can get it from food, that's best. Protein supplements aren't bad, but they're probably unneeded if you're doing your dietary intake the way it should be done. And so that's kind of my take on protein. And usually people kind of understand it once they do the math themselves. But the key to having enough protein on board to build muscles is to be eating enough calories so that you have a reserve left for that recovery process.
Yeah, that's great. I think, yeah, exactly as you said. I mean, we eat a lot of protein, but our body doesn't utilize that protein in the appropriate way for muscle recovery and muscle growth because it's using it as a fuel. So we have to increase our carbs and our appropriate calories to kind of use that as our fuel source. And I think that's, something that's misunderstood quite a bit.
If I could add on to that, the biggest thing I get when I do these kind of one-on-one sessions is that people want to gain weight. And the number one thing I tell them is you need to add, in general, about 300 to 500 calories per day. Depends on their weight. But the large portion of that is not protein. It's a very small amount of protein, basically, what you would normally eat in your diet. So I think that just kind of understanding that concept, stealing from one to get the other is what people have to understand has to be done if you don't have enough calories.
Yeah. This is a hard subject to talk about because I feel like we could talk for an hour and a half on this. I'm sure you could pretty easily because it really dives deep and it's a very interesting concept. I definitely recommend people to listen to your presentation, which kind of goes a little more in depth into some of these things. Join us next week for more with Dr. Hall regarding sports nutrition.
Thank you for joining the orthoPAC podcast. We also welcome you to visit our website, paos.org, where members can download virtual conference content and get Category 1 CME. Also, if you're a non-member, please visit the aapa.org Learning Central for the PAOS virtual content.